This is the standard tube that we use here at Kindred. This is a gastrostomy feeding tube, or a G-tube, or commonly referred to as a PEG. But it's special. It has some special characteristics, and it's one of the reasons that we've chosen this tube. First of all, getting back to the 2-week time frame, at which point the distance between the external fixation device and the internal bumper needs to be loosened to allow easy movement back and forth. This one's a little bit tricky. What you'll see is you'll see this up against the patient's skin. This is a special external fixation device that's actually 2 pieces, and it comes apart very easily. This just slides on there, and there's a little click, and you can pinch it and it comes apart. This then pops out of there, and then this moves back and forth very easy. So this is how you loosen it. So after 2 weeks, this needs to be, typically it'll be at around 3 centimeters. That's kind of the common distance between the stomach wall and the anterior abdominal wall. And so when you actually see this after it's been placed, it's going to be about like this. The reason that we like this tube is this right angle creates a scenario where if the patient pulls on it, it's a little bit tougher. The force is diverted to this round ring, as opposed to the more common type of G-tube that's a straight pull. So it makes it a little bit more difficult for the patient to pull it out. The other thing that's nice is that the skin is exposed to the air with this type of external fixation device. And so you get less problems with skin breakdown and infection in an anaerobic environment. So again, it's really important that after 2 weeks, that one of the nurses taking care of the patients will come up, they'll slide this back, they'll pop this out of the little groove, they'll slide this back about 3 or 4 centimeters, pop it back into the little groove, and put this back on again. Okay? The other reason that we really like these tubes, as opposed to the more commonly placed G-tube, is there's a difference in the internal bumper. This is made out of rubber. It looks like a little mushroom cap. It's designed to be pulled out of the patient when the patient no longer needs a feeding tube, but the amount of force that has to be applied with these is fairly great and traumatic to pull these out of the patient. Okay? We do it, but it's sometimes pretty brutal. So we will more commonly do an endoscopy and remove the tube that way. These are supposed to be collapsible, but they're not super collapsible. The best tube to remove, obviously, is a balloon tip tube. And I'll do this even though this is pretty obvious. But with a balloon as an internal fixation device, if it's time to remove the tube or change it, you deflate the balloon, slides right out. So the type that we use, the CorPak, was chosen because it's kind of a hybrid. What's at the end is actually a balloon. And what inflates it is the sponge that's inside there. And there's actually a little teeny channel. It's basically a balloon channel that's colored yellow. You can see it on the side of the tube. I don't know if you can see it in the video. But it's connected to this balloon. Now when we place these tubes, when we put the Y adapter on the end, it clogs up. You know, here's our standard Y adapter. When it's on the end of the tube, it actually pinches that yellow line, which is the air channel that goes down to the balloon. So when this thing needs to be removed out of the patient's body, they no longer need the G-tube. If we just cut the tube and it opens up that channel, and when we pull, the balloon actually collapses. I don't know if that makes a lot of sense, but again, the reason we chose this is that this is removable without doing an endoscopy by simply cutting the tube and pulling it out. That opens up a little port that feeds down to this balloon and allows it to collapse. Again, when the Y adapter's on there, it pinches that and it makes it harder. It sort of traps the air in this balloon. The other reason that we chose these is that it comes with a jejunal feeding tube that can actually be fed through it. And allows you, just like we were talking about with the GJ tubes, allows you to either feed the stomach and the small intestine, or more commonly suction the stomach while feeding the small intestine.